Hello, Dr. Mountcastle. We are going to do a breast augmentation 101 today. So I'm going to ask you a couple questions and you can explain.
Fantastic.
All right. So how long does a breast augmentation surgery usually take?
A breast augmentation surgery typically takes about an hour. It should range between 45 minutes and an hour. This is done in the hospital under general anesthesia. Basically, the patient comes into the hospital about an hour or two before the surgery, gets checked in, and spends about an hour in the post-anesthesia care unit thereafter. So it's about a 3-hour process from start to finish, but the actual surgery should take around 45 minutes to an hour.
Okay. And what sort of anesthesia should patients expect to receive with this surgery?
The patient for a breast augmentation generally always receives a general anesthesia. Now, general anesthesia is kind of a global terminology because general anesthesia really refers to level of consciousness. So you can do a LMA or you can do an endotracheal tube, and they're both general anesthesia. It's just more of what level of protection of the airway do you do for that general anesthesia. You can even provide IV general anesthesia and knock somebody out enough just with an IV, but then if you knock them out too far, then they could have trouble breathing. So that's when you have to protect there. So it's more, when you just say general anesthesia, is more about the level that what you need to protect the airway during the procedure.
Okay. And can you give a brief overview of the techniques used in this type of surgery?
The general techniques for breast augmentation are and the number of things the patient has to decide between. First, they have to decide incision site. There are 4 main incision types. Underneath the breast, which we call an IMF incision, around the areola, which we call a subareola incision, through the axilla, which we call a transaxillary incision, and through the belly button, which is called a tuba or transumbilical breast augmentation incision. I do not recommend the through the belly button. It's a bit of a gimmick and it should not be done. The other 3 can be done, and they all have pros and cons of each approach, which I will address in a separate lecture.
Okay. What kind of breast implants do you use?
I use saline and silicone. Well, getting back to the choices the patient has, is the next choice the patient has is what type of implants they can use. There's saline implants and silicone implants. The implants come in different shapes and sizes. There's gummy bear type implants, there's shaped implants, and there's different fill of silicone implants. So it's hard to just explain in a few minutes the different types of implants, but now we have so many different choices. So a thorough physical exam with breast measurements should always be done in a breast augmentation consultation. The next thing that always has to be decided between what type of implants is also what size implants you want to go to. So doing a thorough sizing with special sizer implants is of utmost importance in the process. So where the incision goes, the type of implants, making sure the sizing is done correctly, and then under or over the muscle. So the implant you can either put on top of the muscle or below the muscle. If you put it on top of the muscle, it tends to give the breast a more rounded, I have a breast implant look. If you put it under the muscle, it tends to take the roundness out of the top of the implant and make it have a more natural look. So typically under the muscles more natural, over the muscles more rounded, that it states that I have an implant.
And in what instances would you use those?
When it's a patient preference. So some patients want to have a rounded look at the top of the breast. The vast majority of my patients want to have the more natural appearing breast. They don't want to let others know that they have breast implants. But there's some out there who want more cleavage or rounded implants at the top, a more unnatural look, and there are those that do prefer that. So that is a preference.
Okay. Well, thank you, Dr. Mountcastle, for giving us the 101 on breast augmentations.
You're very welcome.